in this episode, we're going to be looking at where do clinicians go wrong using acupuncture and dry needling. And I thought this was going to be fairly an interesting topic to cover, because when we're dealing with students on acupuncture and dry needling courses, I'm often kind of setting the scene as to, well, how do I see this fitting into our day-to-day practice? And obviously I'm there to promote how fantastic acupuncture and dry needling is, and this is going to be amazing, it's going to change your life, and it is. But there's also a need to talk about, well, where are the potential pitfalls in this? And so you end up talking about this. And actually, when you do like CPD courses, so people who are already practicing in needling, you know, they're coming back to us and saying, well, this is not working, or this is not going as I expected. So what I thought is I'll go through kind of like what we think is like the top 5 areas where maybe clinicians are going wrong with the acupuncture and dry needling. So first up is, I mean, I've labeled it inadequate training, right? But maybe it should be more around sort of scope of training or what your training covered. Now, if you're based here in the UK, we tend to separate acupuncture and dry needling into 2 different phrases. So we say acupuncture when we're talking about needling acupuncture points, and we say dry needling when we talk about needling trigger points. The confusion comes where there are some training courses which blur the lines on this. And so we've definitely had scenarios where people have said, hey, I use acupuncture. I've done an acupuncture training course. And when we've looked at the learning outcomes of the course, or sometimes that doesn't help, and actually when they come on to like a specialist acupuncture dry needling training course, we see that actually what they've done as part of their training isn't what would be considered acupuncture. So for example, they'll have done training which says something like Western medical acupuncture. And in reality, it is literally they've been taught to like stick needles somewhere around here. Now, I'm not saying that doesn't have an effect. It will have an effect, because you giving a stimulus to the body anywhere around the body is going to have some impact on like physiology. So your brain's going to record it. Your brain's going to interpret that message. It's going to say, well, okay, we're going to do something about it. But if you want to get better results more often, you definitely need to be thinking about exactly where you're putting your acupuncture needle. And what we have found enough and more frequent enough to know that it's just sometimes about the type of training that people have done, is that if you have just kind of gone into this idea of like, well, look, I'm just going to put needles somewhere around the knee and it doesn't really matter where they go, you really struggle then about getting the impact, that your potential impact that you could have. So you're not going to get the dramatic results. You're not going to get them that often. And it kind of gets a bit variable. And so you don't end up using it because you're a bit like, well, it's a bit meh. It kind of works for some people, kind of works some of the time. And you're not going to get anywhere near the benefit from it. So the training is really important. And it may be that, you know, where you're working or whatever, putting needles kind of around of an area suits it. But I don't really see where that would be any better than doing a proper training course. And obviously I've got a bias here, right? I'm running a training company that teaches people to use acupuncture dry needling. So I'm obviously going to say you need to do something proper. But, you know, what I would say is that just have a look at what they're doing, all right? If there's specificity in there's like very specific references to specific acupuncture points, about the evidence base, about dry needling trigger points, as well as needling acupuncture points around the limbs and the trunk and the face and head, then you're probably good to go, all right? We've got plenty of stuff on our courses and we kind of outline it all. We chat to people before they book up, but I would say that's the big one. When people are coming to me or they're coming to my team or they're coming out of courses and they're saying, I'm not getting these fantastic results that have been promised, it's often because the training that they've had just doesn't really go into enough depth and enough accuracy. I think the second point, which is related to that, is people fall into bad habits, and that's easy to do, right? Like someone like me who's doing acupuncture like day in, day out, I'm using acupuncture, I'm talking about acupuncture, I'm researching, I'm reading the evidence base and stuff. I'm thinking about this and doing this so often that I remember lots of it, right? Not because I'm a super brain or a super intelligent, although I am a super brain and super intelligent. It's because that I'm just doing it all the time, right? But your day-to-day clinician may be using acupuncture and dry needling every now and then. They may be doing it every day, but more likely that's probably every week or every other week. And so they're never going to remember every single acupuncture point to super specificity. So I think one of the big things we do in all of our kind of like post-foundation training, actually, we spend like an hour and a half just going back to the basics. So what I tend to find where people aren't getting the most out of acupuncture and dry needling is a lot of the time they're not using a big enough needle. So they're kind of needling really, really superficial. They are not putting it in the right place. So they're kind of saying, I'm putting it somewhere around here. And they're not, it's not necessarily to do with the training. It's just that they forgot where the acupuncture point is, or they've kind of fallen into a bad habit of saying, well, it's somewhere around here. So it's not in the super duper accurate place. And then the other part of it is like not looking for Tai Chi. So if you're going to get like a big response, if you want to get the biggest responses in acupuncture, you got to look for that Tai Chi sensation. And I would say that's the three things I find on very experienced clinicians, and they're still safe. It's not a safety thing. It's just more that falling into bad habits. They're not in the right place. They're not using a big enough needle, and they're not looking for Tai Chi. Second thing I've got here is poor assessment or over-reliance on needles. And I think this surprises a lot of people that when they come and do our courses, or when they're talking to me about acupuncture and dry needling, I'm not like some acupuncture nut, right? My PhD is in acupuncture. A lot of my research is in acupuncture, and I teach acupuncture. So I'm obviously going to think that it's pretty good, right? But it's not the be-all and end-all. It's not for everybody and for everything. And so I'd be really hesitant to recommend acupuncture for anything and everything. And in fact, not hesitant, I don't. It's not going to be for anybody and everybody. And you've got to, I think where sometimes people kind of get it wrong with acupuncture dry needling is they try to needle everybody for everything. It's not going to work for everybody and everything. And so you've got to kind of find your groove as to where it works for you. I mean, I tend to find acupuncture works really good with chronic problems like back pain, migraines, osteoarthritic symptoms, tendinopathies. I don't tend to find it work, or I wouldn't say it doesn't work, but you kind of got to pick and choose when you would use it for other conditions. And that's just kind of how it goes, right? And, you know, you can get somebody coming in and thinking, right, your tennis elbow is going to respond lovely to this needling technique. And it doesn't work, all right? So don't just keep on persevering with it, right? And don't try and treat everybody with everybody that comes into the clinic to think, I need to needle them. I kind of have a bit of a rule of thumb. If I'm going to needle somebody, I'm going to needle them 4 times. They're going to have 4 sessions of acupuncture or dry needling in a very short period of time, really close together. And then we kind of do like an arrangement here. And I'll say to them, look, we're going to give it a minimum of 4 sessions because in my experience, you need about 4 sessions to make a call on this. And if after 4 sessions, you're getting no benefit at all, we're going to knock it on the head and we're going to move on. So maybe that's one of the mistakes that some people make, is that they keep on going. They keep on almost like flogging a dead horse. So not to say that people don't get benefits after 4 sessions, because there will be some people, but I think on average, if you can agree upfront with your client, look, we're probably looking at about 4 sessions, I think then you're setting expectations pretty well. I certainly don't see this on our courses, but one of the things we've written down here is about ignoring contraindications and red flags. Thankfully, we really hammer home on this, so that's not something that I hear. Or maybe people aren't telling me, I don't know, but certainly you see this in certain clinics. You hear these stories from clinicians who have been interacting with patients who've gone to see somebody else, and that is where people are using acupuncture for stuff when it's not safe. And I'm not saying about sticking a needle into a lung, not safe here. I'm talking about where somebody's displaying signs and symptoms of a serious pathology. As much as acupuncture is fantastic and it's mint and it's going to have fantastic results, if somebody's got cancer, if somebody's got like cord equina symptoms, if they've got some serious pathology, although the needling in itself is very unlikely to cause an adverse event or a serious adverse event, it's about delaying that person going to see a more relevant healthcare professional. And so, unfortunately, this thing does happen in the UK where clinicians or practitioners kind of see this person, and I think they do it from a place of wanting to help, by the way, but they say, okay, I want to try and help these symptoms and want to try and treat you for these problems, rather than recognizing that actually this is potentially something that's a serious pathology and you need to go and see a medical professional right away. So it's not that the needling in itself is dangerous, it's more about the delay that causes and those basically delaying getting more appropriate and accurate treatment and diagnosis. The next bit, which is something that I'm a huge advocate of and I talk about all of the time, right? So lack of integration with other treatments and other interventions. If you do this from a traditional Chinese medicine perspective, if you're doing this from a very Western perspective, it doesn't matter. Acupuncture and dry needling should be done with other stuff. It's not a standalone. It's not a be-all and end-all. If you're going to get the most out of a treatment session, I think that acupuncture and dry needling can be fantastic, because what it does is it's an enabler. It enables people to do more. So if I can reduce somebody's pain intensity or pain sensitivity, they're more likely to be able to tolerate more movement, for example. So being a physio by background, I'm kind of biased towards thinking about trying to restore normal movement. So if I can reduce somebody's pain intensity, they're more likely to be able to move more freely. But, if you've got, say, like an osteoarthritic knee, it's all well and good me giving you some pain relief through needles, but if I don't do anything else with it, well, after a few weeks, that pain's just going to come back. So the idea is that I'm using me needling to enable me to do the strengthening work, or enabling me to do some manual therapy or to do some exercise-based therapy. I'm probably enabling a better education experience, because if I've give somebody some pain relief, that's something that they can sort of buy into, right? They can almost touch it. Like, look, I feel better. So they're more likely to believe what I've got to say. They're more likely to listen to what I've got to say from an education perspective. And so you're more likely to get buy-in, all right? And that's how I kind of see it with that. So doing just needling by itself and not doing anything else, I'm not saying that you're not going to have some changes to symptoms. You are, but you are less likely to have like longer term changes to symptoms. And if you're thinking about behavioral change, if you're thinking about trying to empower people to manage their own conditions, then I think something like acupuncture and dry needling is a really good way to get in there, because it enables them to do some stuff like the exercises or the movement patterns you want to encourage, but also a buy-in to listen to you. Okay, it doesn't really matter what your title is. It doesn't matter how good you think you are and in your ego, how good your colleagues think you are. It really boils down to is, can you give somebody a positive experience? If you can give them a positive experience, they're much more likely to believe you. Something called the halo effect. You can go and explore that. It's nothing to do with acupuncture or healthcare. It's a behavioral insights theory. The other one, I think the final one I've got in here, is about poor communication with your patients and your clients. I think this probably applies more so in the NHS, because you tend to have a ceiling in terms of how many sessions you can treat somebody. Obviously, that's a blanket statement here. I'm thinking of MSK departments here, and perhaps that's not the same for like inpatients or people who are in certain pathways. But where I'm thinking here is that, if you have somebody in for a few sessions of acupuncture and you haven't told them that actually we were going to have to knock acupuncture on the head at some point in time, people can get a little bit annoyed about that. I also think about, what I said earlier about the 4 sessions. If I'm setting my stall out right from the beginning, I'm saying, look, we're going to give this 4 sessions. And this works benefits on both ways, whether it's private sector or NHS, which is to say that I'm setting the expectation that it may take 4 sessions for us to start noticing a difference. And if I don't tell people that, there's a temptation for people to have like one session and go, didn't work, and they don't come back to you. So you get a bit disgruntled, or you get a bit disillusioned, thinking, well, maybe his acupuncture doesn't work, and all these dramatic changes I was promised they're not materializing. Well, sometimes you just need to give it a little bit more of a chance and give it up to 4 sessions. It works the other way though, and sometimes people are a little bit worried or concerned that by offering acupuncture, and if it works really, really well, that people become reliant on it and keep on coming back and coming back and coming back. I think that's where the education comes into it. You explain to people that, look, acupuncture we're using as an enabler. This is the thing that's going to allow you to do the other stuff, and the other stuff is the stuff that's going to help you in the longer term. So those comms with your clients, your patients, about the benefits of acupuncture, how long the benefits may last, and how you maximize those benefits are really where I see people kind of falling down. So there'll be people where they'll say, well, I'm doing acupuncture and after 1 or 2 sessions, I'm giving up. Give it minimum 4 sessions. But similarly, don't give it like 7 or 8 sessions, all right? If you're not getting any benefits after 4 sessions, it's probably not going to work. That's from my personal experience, by the way. I don't have an RCT on dosage, which compares 4 sessions versus 9 sessions. It's just kind of like in my experience, and that's how I teach it as well. Finally, I think there is some confusion out there around the philosophical takes on what acupuncture is. Not so much on dry needling, but certainly on acupuncture. And I think the problem with that is if clinicians are using a descriptor that is predominantly based in, say, traditional Chinese medicine, and the person that's in front of you, whether that be a peer or a colleague, or whether that be a patient and client, and they don't buy into that philosophy, if you're using terminology that is alien to them, you're going to alienate them. They're not going to listen to you. They're not going to really buy into it. Even if you think that this is going to be really working, you're using terminology like yin and yang, qi, that could turn somebody off, and they're like, you know what, I'm not going to buy into this. And so what you might get is a lot of resistance or more resistance to using needling. It goes the other way though. A lot of people seek out acupuncture because they are disillusioned with the traditional Western medical system, and so they are looking for something else. So it's a really nice, easy way of doing this is that if I'm going to broach acupuncture or somebody's asking about acupuncture to me, I just ask them like, well, what do you know about it, or how do you think it works? I mean, you're not expecting them to give you like a really detailed answer, but if they're kind of leaning more towards the language they're using is more of like a traditional Chinese medicine type thing, like wellness and energies and stuff, then I'm maybe more inclined to talk to them and explain how it works in a more traditional Chinese medicine perspective, as opposed to a Western perspective, and vice versa. If I'm picking up that people are talking about pain physiology, talking about like endorphins, all that kind of stuff, I'm probably more inclined to describe the actions and the benefits in a Western phrase. So I've just given you a few kind of quick fire ones that I find that are the barriers to the effectiveness of acupuncture and perhaps where clinicians are going wrong. As always, with all our podcasts, and I'm sure you're sick of hearing me saying this, but I'm going to keep on saying it. Please like, comment, and share. It really does make a massive difference. I need the feedback from you. Is this working for you? Is this something that is beneficial? Is it helpful? Would you like to see more of this kind of stuff? Would you like to see more of something else? Any little comment would be fantastic. If you wouldn't mind sharing it, that would be incredible. So I'll see you on the next pod.